Hello, I'm Dr. Lakshmi Ananth, consultant ENT surgeon with Apollo Hospital, Sheshadripuram. Raise your hand if every cough or sneeze you're hearing these days is freaking you out. I guess that describes almost every one of us today, right? What abnormal times we are living in, and yet every one of us is trying to take it in our stride and trying to get used to what we're being forced to call the new normal, right? And amidst all this coping with all these stresses, if suddenly your world comes crashing about your shoulders in the form of you or a loved one suddenly starting to cough or sneeze, what do? Let me take you through some basic steps to follow if you or a loved one should catch a cold in these trying times. First, wear a mask. Yes, that's right. I said wear a mask. Wear a mask at all times, even at home. Every time we cough or sneeze, we produce what are called aerosols. Aerosols are these tiny particles of our mucus that are expelled from our nose or throat when we sneeze or cough. So they are invisible to the eye and they contain the germs that live in our nose and throat. So when someone else breathes this air in, they tend to inhale these aerosols and they can catch the germs that are in them. This is usually how respiratory illness is spread. And this is also why traditionally we are told to cough into our hand or kerchief or look away when we cough. So when you wear a mask, you're basically preventing your aerosols from exploding into the air around you and are preventing spread of infection to your family members. If your family is also wearing a mask, then the protection is doubled. Next, isolation. Try and isolate or at least distance yourself. Do not go rushing out to meet everyone. Cancel those appointments, those meetings. Even at home, try to confine yourself to an area or a room to the extent possible. At the very least, avoid mingling or getting very close with your family members. This will go a long way in preventing spread, whatever germ you caught, spread to your family members. Next, possibly the question that is uppermost even in your mind: should you get tested? So compared to a cough, a runny nose and sneezing, not so much, but a cough is a symptom that warrants testing. A cough, fever, body ache, headache, and a loss of sense of smell, an inability to smell very well. These are all known today to be fairly typical of COVID-19 and absolutely warrant testing. When is the best time to get tested? In about 3 to 4 days after the onset of your symptoms. Testing before that could lead to a negative test because one may be in what is called a pre-symptomatic phase. Delaying testing beyond that could lead to delay in getting timely treatment. The next question is, what should you get? Should you get an RT-PCR or a rapid antigen test? It is very tempting to get a rapid antigen test because you're told that the test reports will come within an hour, right? But one should also remember that the rapid antigen test is associated with a very high false negative rate. So what is this false negative? A false negative test is when a person has a disease but tests negative for it. So false negative. So that can be very misleading. So this is what happens in a rapid antigen test. You could have it and still test negative for it. This is why sometimes doctors ask you to get the test repeated and this time an RT-PCR. So false negative rapid antigen test is not foolproof. This is a lot of information to process and digest, isn't it? But you do not have to wade through all this all by yourself. You can get an online consultation or a physical consultation, get a doctor to go through with your symptoms and get help in deciding whether you need to get tested, when, how, and such things. In the meantime, what if you have other symptoms not suggestive of COVID, other ENT symptoms? Well, if it's just a flare-up of a long-standing disease like your allergies or your sinus symptoms or your thyroid, then it's perfectly okay to get an online consultation with your doctor. But if you're having a nosebleed, or if you're suddenly unable to swallow, or if your child has stuck a button up his nose, and we both know you need to get to the hospital. Not everyone who shows up at the hospital is tested for COVID. That is another fairly common misconception. There is a screening area where everybody is evaluated. Those people with a risk for COVID-19 are sent to a separate area where they are screened and tested for COVID. In the same screening area, if you can be clear, it can be determined that you're not at high risk for COVID, then you can be cleared to enter the OPD building and meet with the doctor for whom you have an appointment. While at the hospital, we have a lot of guidelines in place to ensure your safety. For your part, you can ensure that you're wearing a mask at all times. Do not lower your mask every time you speak. And when I say mask, I'm talking about a mask that covers your nose and throat, not a strip of cloth that will either cover your nose or your throat at any given time. Maintain distance even in the hospital. Do not crowd at any point or place. Try to carry your own water bottle. Also use the restroom before you leave your home, so you don't unnecessarily use public restrooms wherever you go. So it's small things like this that can go a long way to help ensure your safety. Stay informed, get the right information. Do not fall prey to misinformation and rumors. Stay safe, take care of yourself and your family members. I think together we can fight this.